now on the American Health Journal. They are considered harmless, but can be a scary experience. Symptoms of an ocular migraine can cause unexplained and dramatic changes in vision, which include flashes of light and bright colors circling the borders of your field of vision. We spoke with Dr. Ragui Sedeek at Desert Regional Medical Center in Palm Springs to learn about this condition.
The ocular migraine is where you have visual symptoms that are similar to an aura of a migraine, but without the actual headache, and that's why we call it an acephalic, so without the headache part of it. And the visual symptoms can be known as a scintillating light, so basically a kind of a zigzag line of light with different colors, spectrum on the edges of it, and it's most commonly in both eyes, so in your whole visual field. And it starts in one corner and travels across or enlarges and can last for a few hours. What we understand so far that it has to do with some chemical imbalance in the vascular system, and that chemical is called serotonin. And what we understand is there is a component of like vasospasm where the blood vessels actually constrict and then they dilate quickly in the back of the retina, and or in the occipital lobe in the head, in the brain, and that can cause those visual symptoms to develop. It runs in the family. There's definitely a family history of ocular migraines. Ocular migraines are more common in adolescents and teenagers, at least the initiation of when the migraine symptoms start, and then they can remit for a long period of time and then appear again after the age of 50 or so. But there's usually a past history of migraine. If a patient has never had migraine before and starts developing new symptoms of migraines, especially if they're on one side of the head, they localize only on one side all the time, then that actually needs to be imaged with an MRI or a CAT scan to make sure there is no vascular malformation, what we call AVMs or arteriovenous malformation, or also any intracranial mass that could be masking the ocular migraine. There are other things that we have to rule out. One of the most important things is a transient ischemic attack, or an amaurosis fugax, which also has to do with the circulation. But basically what it means is that there's not enough circulation going to the occipital lobe for a period of time for one reason or another, and that needs to be worked up and treated appropriately. There's also a possibility of having something called the posterior vitreous detachment, where the gel body in the eye is separating from the retina, and the actual mechanical forces of the separation can cause physical stimuli of the receptors of the retina, giving you flashes of light, which also needs to be screened for and treated appropriately if there's associated retinal tears or holes or other pathologies.
Is there any treatment for ocular migraines?
If there's no mass or there's no AVMs, then you can treat the migraine. Obviously, if there is a headache, you can treat that with a non-steroidal anti-inflammatory. There's also dihydroergotamines, which is a special class of drugs that have been very useful for migraines. Because we mentioned one of the chemicals, serotonin, there's actually selective serotonin reuptake inhibitors that can be used. Also, tricyclic antidepressants can be used for chronic treatment. And if patients suffer from chronic migraine or having multiple bouts of migraine during their week, then there's actually prophylactic treatment with beta blockers or calcium channel blockers so that they would not have as many episodes of migraines.